Good afternoon to everyone watching. This is Dr. Amit Naragund, Specialist ENT Surgeon working at Al-Sharq Hospital and Etihad Medical Center, Fujairah. I have been working in UAE since the past 8 years and at Al-Sharq Healthcare since past 5 years. Today I will be talking to you on the topic sinusitis, its causes and the treatment. Now, this sinusitis is a very common condition which we see in this part of the country or in this part of the world. This is because of the environmental conditions which are very hot and humid and the dependence on AC and also the fine dust and sand which is there in the environment. So, because of this we are prone for the allergies, and this in turn causes sinusitis. Most of you here must have either experienced personally or have seen your friends or family members suffering from this condition. So, you should not ignore this condition because it can worsen and it can cause sequel or complication if it is not treated in time. Now, before talking to you about sinusitis, I would like to tell you about, you should understand what do you mean by this sinuses. What are these sinuses? What is their role in our body? So, now these sinuses are nothing but they are hollow cavities which are present in our skull bone. So, they are present all around in our skull bones, in the facial bones, and they contain air normally. So, there are 4 pairs of sinuses in our body, each on either side of our nose. That is why they are called paranasal sinuses. Now, these are the frontal sinuses which are present above our eyes on the forehead, the maxillary sinus which is present on the cheekbone here next parallel to our nose, the ethmoids which are present deep between inside the nasal bone just next to our eyes, and behind our eyes or deep inside the nose we have the sphenoid sinuses. So, they are pair of sinuses on either side of the nose. That is why they are called paranasal sinuses. Now, they open into the nose through small openings through which the sinuses get air. So, for the sinuses to stay healthy they need air. Okay. So, and that air comes from the nose, the breathing from the nose. Okay. So, when these sinuses, the openings of these sinuses gets blocked, in that case the sinuses will get filled with fluid and they get inflamed, and this is called sinusitis. Okay. So, in simple terms, any inflammation of the mucosal lining of the sinuses is called sinusitis. So, how does this, what are the causes for this sinusitis now? So, anything which blocks the ventilation and the drainage of these sinuses causes sinusitis, because these sinuses, the mucosal lining, as I said, the tissue which lines the sinuses, they produce some mucus. Okay. This mucus which drains down into the nose through these small openings, and they keep our nose healthy and moist. Okay. So, the mucus has some antibacterial properties and this helps in keeping our nose moist and healthy. But in certain cases, due to some inflammation or allergies, when these openings get blocked, the mucus gets trapped inside the sinuses and the air inside the sinuses gets absorbed. So, the sinuses are also not getting any air from the nose because of the blockage. So, any cause which interferes with this ventilation and drainage of these sinuses will result in sinusitis. So, what are these causes? Now, the causes, the most commonest cause is a common cold. So, the common cold is the commonest cause for the sinusitis. So, a common cold, if it is not treated, it can prolong, and if it prolongs for more than 7 or 10 days, we have to suspect that the patient may be having some sinusitis. The second most common cause is allergy. So, allergies of the nose. So, allergic rhinitis is one of the commonest cause for sinusitis, because this allergy can cause a localized inflammation in the nose, and this inflammation or the swelling can block the sinuses and this can result in sinusitis. The other causes are any structural or anatomical abnormalities like the deviated septum, which is also very common. Okay, the bone which is supposed to be in the midline, the partition between the two nostrils, is not straight, it is deviated towards one side or both. In that case, this can block the sinuses. Also, there can be other causes like an enlarged turbinate, an extra nasal growth that is called nasal polyps or adenoids in children. So, these can block the sinuses and can cause sinusitis. Another most common cause is smoking. Smoking predisposes to the sinusitis. So, smoking carries a very high risk of causing sinusitis because smoke is a strong irritant, and also the smoking can reduce the mucus clearance from the sinuses, thereby causing sinusitis. It is not only harmful for the person who smokes, but also the people who are around him. Okay. So, even the active, not only active, but the passive smoking is also not good. Okay. This can cause sinusitis. Okay. So, these are the basic causes, common causes for the sinusitis. So, how does a patient present to the clinic? When should you think that you may be having a sinusitis? Now, the most commonest presentation is the nasal obstruction. So, the patient will have a stuffy nose, he cannot breathe through the nose, and at the same time he will be having a headache or the facial pain depending on the type of sinus which is affected. Also, there can be some post-nasal drip. This is nothing but the mucus, because the nose is blocked from the front, the mucus cannot come out, it goes back into the throat, and this post-nasal drip in turn causes irritative cough in the patient. The patient also may have some low-grade fever, tiredness, and maybe loss of smell in certain cases. Okay. So, it depends on what sinuses are affected, and this sinusitis, depending on the duration, we can classify into acute, subacute and chronic. So, if it is less than 4 weeks duration, then it is called acute sinusitis. If it prolongs for more than 4 weeks to 12 weeks, it is called subacute, and if it is more than 12 weeks, it is called chronic sinusitis. So, the symptoms depend on whether it is acute or chronic. The acute sinusitis, the symptoms are more severe. Okay. So, the patient may present with more severe pain, headache, they can be the pus in the nasal discharge, which is purulent, it is nothing but pus, and patient may be having fever and low grade fever, fever and fatigue and tiredness. But the symptoms in chronic sinusitis are much subtle, in the sense they do not cause that much suffering because they are there for longer duration, and the patient may just have some nasal obstruction and a post-nasal drip. These are the two common presentations for the chronic sinusitis. The patient will not be having that severe headache like in acute sinusitis, but he will be just having a heaviness in the head and the facial heaviness. So, these are the common ways in which the patient present to us when they have a sinusitis. Now, how do we diagnose this, and what are the investigations to be done to know that the patient is having the sinusitis? When the patient comes to the doctor, we first take a detailed medical history. Okay. So, this is for us to know the possible causative factor which is causing the sinusitis, and in the detailed medical history includes a history of any allergies, history of any nasal obstruction, and how much duration he is having this. Is it one-sided, both-sided, where exactly is the patient having the pain and the other symptoms. After this, we do a detailed examination of the nose. In this, we look for any anatomical abnormalities or any swellings in the nose, like the nasal polyps, enlarged turbinates, possibly because these could be blocking the sinuses. Also, we look for any purulent or the pus within the nasal cavity. If we see any pus or mucopus within the nasal cavity, that is a straightforward diagnosis that the patient is having sinusitis. Then we just palpate over the sinuses and then check for the tenderness. So, again the tenderness varies depending on what sinuses are affected. So, clinically just by pressing on the sinuses we can diagnose the patient may be having these sinusitis. It may be if you have a tenderness over the malar bones over the cheek, then the patient will be having a maxillary sinusitis. If the patient is having a headache on the forehead, and if you press on the over the forehead, if the patient is having pain, that means he is having the frontal sinusitis. The sphenoids are much more deeper, so we cannot palpate them. The ethmoids, if you palpate on the bridge of the nose, if the patient is having the pain, then that is called ethmoid sinusitis. So, this is what we do. This is the basic clinical examination we do when the patient comes to us to the ENT clinic. Then we also do certain procedures at the OPD wherein we can diagnose the sinusitis. So, we do a diagnostic nasal endoscopy. So, this is nothing but we just pass a small telescope, which is 4 millimeter telescope attached to a camera, and we look for we pass that into the nasal cavity under local anesthesia. This is done in the OP procedure. It is not at all painful, and when we pass inside the nose, this is because sometimes when the patient is having nose block or congestion, we cannot see directly into the nasal cavity. We may need an assistance of the camera. So, this is the HD camera attached to a telescope, and when we pass this inside the nasal cavity, we can see the area where the sinus is open and they drain. So, sometimes there can be blockage in this area, there can be some pus which is accumulated in this area, and by looking at through this endoscope, we can easily make a diagnosis of chronic sinusitis. Also, it can help in treating the blockage by putting some decongestant drops under endoscopic decongestant packs in the nose under endoscopic guidance. So, this is what is done at the clinic level. If we further send the patient for investigations, but that is the X-ray. X-ray of the sinuses is done to look for the nasal the sinuses which are affected. Okay, but the most important is the gold standard in diagnosis of sinusitis is the CT scan of paranasal sinuses. The CT scan of paranasal sinuses is a gold standard in diagnosis of this sinusitis. So, the CT gives us all the details about the sinuses. This is also a road map if you are planning for the surgery in the future. It also helps us to know what all sinuses are affected and how much is the severity of the sinus, so that we can treat accordingly. So, these are the basic investigations which are done in sinusitis cases. Other than that, we can also take a swab for the culture. Nasal swab can be taken for the culture, and then it can be, this is in cases where the sinusitis which is not responding to the antibiotic. So, we need to look for what antibiotics it is sensitive to. So, we take a swab and send it for the culture, and then we can manage accordingly depending on the antibiotic sensitivity. Now, how do we treat these sinusitis patients? Now, after doing all these investigations, we come to a diagnosis of what type of sinusitis the patient is having. Is it acute, chronic, is it unilateral, is it bilateral? Unilateral means it's affecting one side, or it's affecting both the sides. Is it affecting only one sinus, or it's involving multiple sinuses? So, after doing all this, then we treat the sinusitis patients. Now, always the first line of treatment is the medical line of treatment. So, we treat the patients conservatively by giving him medicine. Now, the conservative treatment is again categorized into two types. First is to treat the cause, and second one is to treat the symptoms. If we just treat the symptoms, the patient is not, it's not going to help the patients. So, we have to treat the causative factor also. Now, as I mentioned, the causes are allergies, the common cold. So, whenever you get a common cold, the first thing you should do is to control the cold so that it does not progress into an acute or the chronic sinusitis. Also, the allergies. So, allergy, if the patient is having allergic rhinitis, it has to be controlled and treated so that it doesn't block the sinuses and cause the sinusitis. So allergies, if the patient is having allergy, you need to treat the allergy by giving him some antihistamines and steroid nasal sprays. If the patient is having an acute sinusitis with the pus coming out from the nasal cavity and severe pain in the head and nasal obstruction, a typical acute sinusitis, then in that case the mainstay of treatment is oral antibiotics. So we give a course of 7 to 10 days of oral antibiotics minimum so that the sinusitis is cured. So along with this, we should advise the patients to use decongestant nasal sprays for a shorter duration of time, maybe around 3 to 5 days. Should the decongestion should not be continued more than 5 days. This is because of the risk of causing rebound congestion. Also, the patient can use saline nasal wash. So, the saline nasal wash is also very important because this helps in washing away the secretions, the infected secretions which are present inside in the nose and the sinuses. Okay. So, these are the basic medical management options which are available. So, we usually try the medical line of treatment based on the severity from 1 week to 3 weeks. If the patient is not responding to this medical line of treatment, then the patient we have to plan the surgery. The surgery is usually reserved for the refractory cases who are not responding to the medical line of treatment, and to the patients who are having any obstructive symptoms or any nasal obstructions, like as I said, deviated nasal septum, nasal polyps, turbinate enlargement, adenoids. So, in these we have to take out the causative factor first, the obstruction. So, in case of a deviated nasal septum, we do a septal surgery, it is called a septoplasty. And if the turbinates are enlarged, turbinates are nothing but the soft tissue which are present on the side of the nose inside, we do a turbinoplasty. If we have polyps, we have to remove the polyps. If the adenoids are there causing, in children especially, we have to do an adenoidectomy. So, these are the surgeries which are needed to remove the obstruction of the sinuses. But when the sinuses are so much involved that it's totally blocking the sinuses and the fluid and the pus is filled up inside the sinuses, then we have to go for the functional endoscopic sinus surgery. So, this is the gold standard treatment for the sinusitis cases. So, it is called functional because we are going to remove only the diseased part of we are clearing only the disease, but we are not touching or we are not removing the healthy mucosa of the nose and the sinuses. So, that is why it is called, this is to restore the normal nasal and the sinus functions. So, we are that is why it is called a functional endoscopic sinus surgery. So, after the surgery the patient will also have to take proper care because their sinusitis is known for recurrence. Patient has to use regular saline nasal washes and also control the allergy even after the surgery. Now, what happens if this sinusitis is not treated? So, what are the complications which one can expect? As you know that these sinuses are present in the vicinity of these very important structures like the eyes, the brain and the surrounding bones. So, it can expand beyond the confines of the nose and the sinuses, resulting in the complications. So, it can expand into the eyes and it can cause complications in the eyes like an orbital cellulitis, abscess. It can go into the brain, inside the brain, and it can cause the inflammation of the membranes overlying the brain, that is called meninges. It can cause meningitis, subdural, extradural abscesses within the cranial cavity. It can also spread to the bones surrounding this because they are into the bony cavities. So, they can cause the inflammation of the bone around it, causing osteomyelitis in certain cases. So, this sinusitis is a very important condition. One should not ignore it and get it treated at the earliest. This is to avoid any further complications and the sequels, which becomes even more difficult for us to treat. Now, we at Alshark Hospital, we are having all the facilities to treat, and we are treating these cases regularly. So, if you have any of these issues, please do not hesitate to visit the hospital and take the treatment, because otherwise if you ignore it, it can cause further complications, and you may need surgeries and other things. So, that is all about the sinusitis. Thanks for watching this show.